The heart is made up of 4 chambers. 2 filling chambers, known by the medical terms right and left atria, and 2 pumping chambers, known as the right and left ventricles. You may notice that the right side of the heart is on the left side of this video, and the left side of the heart is on the right side of this video. That's because when we talk about parts of the heart, we always use the patient's perspective and associate the parts of the heart with their right and left side. Now, let's talk about AVSD. The term AVSD is short for Atrioventricular Septal Defect. Let's translate this into plain English. Atrio refers to the atria, which are the 2 filling chambers. Ventricular refers to the ventricles, which are the lower pumping chambers of the heart. Septal refers to the wall between the right and left chambers of the heart. And defect is a hole or abnormality. In the case of AVSD, the hole or abnormality is in the wall or septum between both the atria and the ventricles. This hole increases blood flow to the lungs, which can cause high blood pressure in the lungs. If this hole is not surgically closed, it can lead to a condition called pulmonary hypertension, or Eisenmenger syndrome. And AVSD also affects the heart valves. In a normal heart, there are 2 separate valves between the upper atria and lower ventricles. The tricuspid valve is the opening between the right atrium and right ventricle. The mitral valve is the opening between the left atrium and the left ventricle. With an AVSD, you can have a wide spectrum of malformations with these 2 valves. One example is having one large valve rather than 2 separate valves. Some patients have a partial AVSD. This means that there is a hole between the atria and a problem with the valves, but no hole between the ventricles. In both partial and full AVSD, if the hole is small, it does not have a significant impact on the heart. However, if the hole is large, the heart has to work harder, which causes the heart muscle to thicken and the heart to get bigger. If you have an AVSD and want to learn more about your specific condition, talk to your doctor.